everybody, thank you for coming today. I was going to say that which meeting it was, the number, but I've forgotten how many we've had. But thank you 16. For coming. Such a sunny day. If I just go through the usual housekeeping and the programme with you at the moment, if that's all right, and if people can keep their mics muted until they're asking the question. So, hi, welcome to the COVID Champions Meeting update, linked to the roadmap, which has a key element to it on Monday, 19th. We've got Kath, who I think most of you will know has been supporting us over the months, and pleased to say she's here today. From Public Health, and we've got Alan from Environmental Health, who's going to talk to us today as well. We have got question and answers on the programme. However, we do have limited information, and we certainly don't have all the answers that you may want questions to. So I'll just stress we can convey what we know, and what we don't know we'll seek questions or answers for, I should say. You can, of course, as always, convey those questions in the chat or email them in. But as I say, at the moment, you know, we've got gaps in our knowledge as well, but we'll try our best in what we can do today. But it is primarily to convey an update on what we know. Next steps and future plans, we'll probably defer that until we get further information from the government, and we'll send out information next week on that. In terms of the housekeeping, we've been there before, and we're all friends, aren't we? So if you just keep your mic muted until you're asking something, post questions, please do in the chat. We'll try our best, but it's possible it will have to be next week before we do a Q&A response to that. Raise your hand as always if you want to ask something. Be respectful and kind towards us all, as we always are. Make sure no distractions in the background, like cats, dogs, or giraffes or whatever. We will be recording the meeting, just to let you know that, as always. Anything we say in the meeting stays in the meeting, except obviously key COVID messages to support ourselves and our communities. And as I've said a few times now and repeat myself, if we can't answer today, and we probably can't, we will follow it up with responses on Monday. If I could therefore ask Kath to give us an update, please. Thank you.
Of course. Hi. For those who haven't met me before, I'm Kath Bailey. I'm one of the public health consultants at the council, although I have been a number of times now, and I think I've probably got a season ticket. Is it fair to say that, Steve? So as normal, we'll start off with the facts and figures, and then I'm going to take you through what information we do have about the roadmap and the move to step 4. We can try and take questions, but as Steve says, we don't have answers to everything at this stage. There is still a lot of guidance emerging, and there's probably guidance being published as we're speaking. So in terms of the current situation for COVID in Sunderland, at the moment, I always feel like I should start that by saying brace yourselves. It's quite depressing listening at the moment, the situation update, but I'll take you through the facts and figures as we know them. So we continue to see high levels of testing in the city. I think this week, if you compare it to last week, is it is up. So still rising in terms of the numbers of tests, I think, or maybe at similar levels to last week. We know that there have been significant pressures on the testing system nationally, and there have been occasions when it's been really difficult to get yourself booked for a test over the last week or so. We understand appointment slots are being reviewed on an hourly basis nationally, and so the advice to anybody trying and struggling a bit is keep trying, because it's likely that more will get released shortly. And generally people in Sunderland seem to be accessing testing, so we're seeing quite a lot of tests happening. Test positivity is still rising, so about 9% of all tests, so that's symptomatic and asymptomatic tests, come back with a positive test result. When we look at only the symptomatic testing for the PCRs, then what we see is a positivity rate of about 18%. So that's pretty high. It's one of the highest figures that we've seen during the pandemic. Case rates have continued to rise, and they are again at the highest level that we've seen during the whole pandemic. I think I said that last time I was here. We're still getting rates rising and therefore higher than anything we've seen before. So our current rate is now 966 per 100,000, and this probably places us third in the National League table at the moment, behind South Tyneside that has a rate of 1,374 per 100,000, and Hartlepool, who've just leapfrogged over us in the last couple of days, and they've now got a rate of 990 per 100,000. 9 out of the top 10 local authorities on the PHE dashboard that I could see today were from the North East. So the North East is definitely well at the top of the league table from a regional perspective. I'm hoping that, you know, I don't want to see us go through that 1,000 per 100,000 barrier, but it may be that happens in the next couple of days. Although I do think the rise in the case rates is starting to slow a little bit, so we'll keep an eye on that and see where we go. In terms of the broader impacts, we are seeing the number of COVID positive patients in the hospital rising rapidly at the moment. So we currently have 60 inpatients in Sunderland Royal, and that includes a small number who are in ICU, so who are very, very poorly with COVID. We're also seeing an increase in the number of deaths where COVID is mentioned on the death certificate. So on the dashboard, you can only see one in the last week, but that data runs with a little bit of a lag because we use the published ONS data. I know we've seen maybe 6 or 7 in the last fortnight, so I'm expecting that the next time you see the dashboard, that figure will be a bit higher. So you can see the sort of impact that those high case rates are having. And the high case rates and the high numbers of people needing to self-isolate alongside that are impacting on our schools, our care homes, our NHS services and our businesses and workplaces. So it's having quite an effect at the moment. Moving on to the roadmap, I think when I spoke to you last time, we were anticipating, but it hadn't been confirmed that we were going to move on to step 4. So the announcement on Monday was very clear that we are carrying on and moving on to step 4 with effect from next Monday, which is the 19th of July. So this signals a new phase in the government's response. It's focused on learning to live with the virus rather than trying to do everything we can to, you know, stop the virus in its tracks. There's a move away from legal requirements and towards advice and guidance about how to protect people and targeted interventions to reduce risks. To support that, the Prime Minister had set out 5 principles for managing how we should all behave in step 4. And so the key elements were continuation of the vaccination programme. So we're working hard to try and improve coverage for the programme. They have been really clear that there is this evergreen offer, as they call it, which means anybody who's eligible and has previously been called but not come forward can still come forward at any point and ask for their COVID vaccination, and appointments will be arranged for them. And I think we've got some interim guidance now about the booster jabs programme that we're expecting to kick off in early September and run through till the end of December or maybe into January. And at the moment, we've just got some really sketchy indication from the JCVI as to what that might include. So they're talking about a 2-phase programme. It'll be targeted on those at greatest risk again. And it's likely that it'll be a COVID jab alongside a flu jab, but we're waiting for confirmation of the details of how that might work and whether you can have your flu and your COVID on the same day or whether you will need 2 separate appointments. So that's one of the things that we don't yet have all the detail of, and we'll have to wait for that to emerge. The second principle was around this shift to personal responsibility and decision making, so move away from the legal restrictions. So that means that all of the official legal limits around social contact and the number of people who can attend various life events like weddings, funerals, that all disappears. But obviously we will still be asking people to think about the risks associated with with however many people you want to meet with. So we're still saying, you know, keep the numbers small, keep it short, do it outside, all of those things that you're used to. The social distancing requirements will be lifted as a legal requirement, except at ports of entry, where they will remain, and we will have to wait for all of the guidance as to what exactly that looks like. But they've clearly indicated that there will still be something expected at ports of entry. The legal requirement to wear face coverings will be gone, but we will still be advising people to think about when and where they want to carry on wearing their face coverings to protect the people around them. Employers will now be able to support the safe return to workplaces, so the general work from home if you can guidance will have been removed. But we're not expecting that everybody will immediately rush back to the office, and certainly the council is not expecting that, and is still advising staff to work from home where they can in terms of managing the risks given our case rates. All businesses and settings and venues can open, so things like nightclubs that thus far have not been allowed to open will be allowed to open from next week. So that takes any restrictions around business opening out of the picture at this point. Display of the QR codes will not be mandatory anymore, but will continue to be voluntary. And what we don't know is how many businesses will just say, well, I'm not doing it because it's not required, and how many will carry on using the QR codes as a means of knowing who's been in their premises and managing the test and trace requirements. There's a removal of the visitor limit for care homes. So at the moment they have an identified number of named visitors who can go into the care home and visit their loved ones. That limit is removed. However, the guidance is clear that all of the infection prevention and control measures that are in place in the care sector will still remain. There'll be no legal requirement for COVID status certification as a condition of entry for any setting, but they are asking businesses to consider whether that is something that they want to put in place. And removal of restrictions for things like in-person teaching at university have been, so they should be able to go back to their face-to-face teaching when they go back in the autumn, and there will be an end to class bubbles as the term finishes at the end of this week. And that's in the early years settings, schools and colleges. So you can see a shift in the way that we're thinking about things and talking about things and managing about things. But I think we would still want to see people behave in a safe fashion. So we might still be advising a lot of those things, even though they're no longer legally required. I'm sure Alan will talk about the difficulties associated with that shift a bit later on. The third principle is that it's been very clear that test and trace and the need to self-isolate will be with us for some time to come. But there is a change to the requirements from that will come into play from the 16th of August. So at that point, any adult who's fully vaccinated, who is a contact of a case, won't immediately be required to go and self-isolate. Instead, they'll be advised to go and get themselves a PCR test. And then only if their PCR test comes back positive will they be expected to self-isolate. And because children don't have the option of being vaccinated at the moment, they thought it would be unfair to carry on with the need for them to be able to isolate if there were a contact. So the requirement for under 18s is also being removed with effect from the 16th of August. And again, the guidance is probably that they'll be advised to take a PCR test, but that may depend on the child's age and their very particular circumstances. So again, it's that guidance about if you're a contact, we'll probably advise you to go and get a test, and then we'll take it from there and advise you accordingly based on what your test result is. But they are really clear that anybody who tests positive on a PCR test will still be legally required to self-isolate, and that it doesn't matter what your vaccination status is at that point. If you test positive, you have to self-isolate. The fourth principle is about managing global spread. So you'll be aware of the government's international travel red, amber, green lists. they're not going to go away anytime soon. But anybody who's been watching the news today will know that the countries on the lists at any time is quite fluid. So they're constantly updating the risks and moving the countries between the different red, amber and green status, depending on the circumstances. And they have announced that there will be a new global pathogen surveillance system, but I have not seen any more detail about that other than that one-liner announcement. And then the fifth principle is around contingency planning, so recognising that where risks increase in certain places at certain times, we may need to put additional measures in. But again, there is no real guidance as to what those measures might look like and, you know, what might be available to us when we're trying to manage high levels of infection. And it is likely to be guidance rather than legislation or regulation, is what we've been told. In terms of responsibilities, you know, it's very clear looking at our case rates, we know COVID hasn't gone away. So we're, you know, currently experiencing the highest levels of infection that we've ever seen. And I've already said that the impact on the hospital, for example, is increasing. So, you know, this is about learning to manage the risks of COVID at individual levels and within our communities, and learning to live with this virus. So, you know, our guidance and our advice is probably not going to change. There are many things that we've all been doing for the last year and a half. Love them or loathe them, we know that those things work in terms of interrupting transmission of the virus. So we will still be encouraging people to continue to do all of those things, such as meeting in well-ventilated areas, outside where possible, wearing your face coverings when you're in places with people that you don't normally spend your time with, particularly if they're in closed spaces, washing your hands with soap and water, and if you can't get soap and water, using a hand sanitizer. That's not going to go away anytime soon, so we'll still be promoting that. The whole catch it, bin it, kill it thing that we've, you know, in terms of respiratory hygiene, again, that's not going to go away anytime soon. We're still going to be saying self-isolate and get tested if you've got symptoms, and that will still be legally required as we move forward. We'll be asking people to test regularly if they don't have symptoms, so that it can help to find people who have the virus who don't have symptoms and don't know that they might be spreading it to others. And importantly, we'll be asking people to consider their own and other people's risks when they make decisions about the sorts of things that they want to do. Key messages then, so this is looking a bit similar to what we said last week, I know, but you know, things have moved on a bit, but not much. So our local infection rates are higher than anything we've ever seen. The pandemic is very far from being over at this point, and the national narrative is about this third wave. And you know, we're not really expecting to see a peak in infections until about mid-September nationally, so there's probably even more to come. Step 4 is the next phase in the process. So it's, you know, it's not that it's gone away. It's not that we've gone back to normal. This is just about a slightly different way of coping with the virus. We're reminding people how to stay safe. So we will be pushing all of those messages that I've already mentioned to you. We're carrying on doing the work with businesses to try and help them to understand what they can do to help to manage the risks. And I think the workplace guidance was only published last night, so we've still not really had enough time to fully understand everything that's listed in the many different versions of that are available on the websites. We're still asking people to help us stop the spread by testing regularly when they're well, and by testing and isolating if they develop symptoms. And the advice about that is, even if your symptoms are really mild, still go and get a test, because we are seeing Delta variant presenting with a slightly different array of symptoms from what we've seen previously. So as I've said already, I think probably several times, our messages are the same as they have been. They're not going to change anytime soon. In terms of how you can help, as always, you can help by sharing all of the key messages. You can particularly help us at the minute by communicating out and sharing what you know about the times and venues of the various drop-in vaccine clinics, and encouraging people to book their appointments as well. You can help us to encourage other people to continue wearing their face coverings. So as a council, Anybody in our council premises, we will still be recommending that face coverings are worn. I think we're hearing on the grapevine a lot of our local businesses might also want to do that, which is a good thing. And I know I was talking to the football club earlier in the week, and they're certainly going to promote wearing a face coverings in the stadium. So that's all in good. There'll be more messaging around that, so things that can help you, bits of resource, social media videos, which Louise is compiling at the moment, and you can help if you want to record a little clip that says why you're planning to carry on wearing your face covering. And I think we're also trying to compile some real life stories, because we know that plays better than all of the facts and figures that I know and love so well. So if you know somebody or you want to share your story, then please do. And then how can we help you to help us to do all of that? Well, we'll send an email after this meeting with more information so that you can use those resources in the way that you normally do. We know that the national campaign materials are being updated. So as soon as we've got the replacement for the hands, face, space, fresh air, whatever the new message looks like, then we'll share that with you so you can share it on. And then I understand that from this week, I presume from next week rather than this week, newsletter is going to move to a Monday. And I think that was it from me.
Thank you, Kath. Very thorough as usual. Thank you. I'm thinking if we're going to have questions, maybe we'll have them after Alan's spoken with us, if that's all right. But just again, we only know what we know. We don't have the answers to everything. Alan, would you like to have a chat with us?
Hi, Steve. Yeah, thanks very much. It's always a pleasure to go after Kath because she covers everything that I was going to cover. So I don't need to say a great deal. No, that's great. But obviously, Kath has covered most of the changes that are going to take place in step 4. I mean, obviously, my input, my angle on this, if you like, it's not the public health perspective that Kath has. I've been leading the enforcement response, so I've been kind of managing the staff that have been dealing with the business restrictions and visiting businesses and making sure that they're complying with the rules that are in place, as we move through the pandemic, really. And so, the fundamental change, and I know that Kath sort of highlighted it, the very basic facts of it, but the very fundamental change, and this really is fast moving. I mean, as we went into this seminar, one of my colleagues was in a webinar that was being held by the LGA, which is the Local Government Association, where they were being told, and they're messaging me while I'm listening to Kath saying that there's an NHS toolkit for small businesses called Let's Keep Life Moving, which will be like a guide for small businesses to make their COVID secure measures compliant with the sort of new approach. And that's in draft form and will be published next week. There's other colleagues in my team who are attending an HSE webinar tomorrow on safer workplaces. The key change in terms of enforcement is that many of the things that we've become accustomed to are no longer law. Now, I kind of came into business restrictions right at the very start of the pandemic when everything was closed, and it was a very simple job for enforcement because if it was open, they had to shut. As we've moved in and out of various lockdowns, the rules have changed 70, 80 different times, and since February we've been in this roadmap and we've become accustomed to a kind of fairly consistent set of restrictions. But things that people have become used to, like the QR code at hospitality venues, sign in, track and trace at beauty and close contact services. I got an email last night from someone in Beers saying we'd believe that those would stay as statutory requirements, despite a lot of the other stuff like social distancing and mask wearing and all that going. But it was literally yesterday that I heard that was not going to be compulsory anymore, and it was just going to remain in guidance. And just from my experience of doing this for like almost a year and a half, is that the Prime Minister in his political statement can say that the guidance is we're encouraging everyone to follow the guidance and continue to do track and trace. But the reality of small businesses in Sunderland and everywhere else is that they will say, what does the law say? Am I required to do it? And if they're not required to do it, they won't. So what you're going to find is a very mixed bag out there on Monday. And I think that we'll probably get lots of calls as a council, and I'm sure other colleagues from other councils will, because you'll find that some businesses who've made statements already, like Waterstones, the bookshop, for example, have said, we're going to require our customers to continue wearing masks because we feel that's appropriate. So in some venues, you'll be asked to to scan in with the QR code or leave track and trace details. And a lot of other venues you won't, and there's going to be a huge amount of inconsistency around. So you're going to find somewhere like the Bridges may have decided they don't need their one-way system anymore, but then you walk into some of the shops within the Bridges and you'll be asked to wear masks. And there's going to be a lot of people very confused, I think, about what the rules actually are. The key change in terms of enforcement is that the current COVID regulations require businesses to have a separate COVID secure risk assessment. So everyone's got to have a risk assessment about, normal hazards like tripping over or slipping over or toxic fumes or those kind of things. But in addition to that, every business had to have a COVID secure, and if they had more than 4 employees, which is not many, you had to have it written down, and then you had to have separate COVID control measures in place. From next week, that goes, and what we're being told is, and like I say, this is all, we haven't had the guidance yet. We haven't had a chance to read it. Some of it hasn't been published, but basically, the COVID measures will become part of the overall premises risk assessment. So people will be assessing the risk at different levels. Some businesses will say, we think we need to carry on with sanitizers and we need to carry on with masks, and other businesses will say, we don't need any of that. And so you're going to, and as an enforcement authority, we're going to get members of the public who feel that business X isn't doing enough, or the capacity is too high, or they haven't got measures in place. But all we've got is the Health and Safety at Work Act. And the Health and Safety at Work Act, when all these specific regulations go, is very prescriptive about what you can and can't do. And the Health and Safety Executive, right at the start of COVID, said you can't serve a prohibition notice on a premises because you don't agree with their COVID secure measures, because it's not an imminent direct risk. Like, under the Health and Safety at Work Act, if you've got a hole in the ground, that's where you can serve a prohibition notice, that someone might fall down. You can't serve a prohibition notice because someone conceivably may come into contact with someone that's got COVID-19. You can only serve an improvement notice, which has got a 21-day lead-in period. And again, the powers that we've got at our disposal in terms of enforcement are very, very much reduced. So I expect that what we're going to find is that we're going to have members of the public who are confused about this mixed bag that they're going to see, with one premises retaining track and trace, one premises maintaining one-way systems, and other premises doing away with it entirely. So we're going to see calls go up and concern go up amongst the members of the public. And at the same time, all of the specific COVID legislation that we've seen and we've been using, all of the enforcement powers we have to serve improvement notices and prohibition notices and all these things which are COVID specific are all being sort of swept away in one go. And we're back to basic Health and Safety at Work Act legislation to deal with it, which is a much lighter touch tool. So we will still have officers. Our COVID marshals have not all been laid off. They're being redesignated as compliance officers, and they will be visiting businesses and talking about the new toolkits and encouraging businesses to keep sensible measures in place. But the enforcement powers that we've got to back that up are significantly reduced from what they were. So, that's where we are. I can't give you, I think Kath's given you the detail. The answer is, unfortunately, it's Thursday afternoon and this comes into force on Monday, and we haven't had half the guidance published yet. And once we do get it published, then I'm sure that, we'll get that through our channels and out to the people who need the information as fast as we can. But, it's been unfortunately, it's always been since last March, you get the political announcement about what the government intends to do, and then you get the legislation at the last minute. And that's how it's been all the way through. And that's where we are still, I'm afraid. So I'm happy, if there's any questions that people have, I'll try and answer. But if not, I think what I agreed with Steve was that if we put them in the text and as an FAQ, if people type in any specific questions, then when we have the answers, we'll do like a sort of FAQ type list of answers when we get the guidance. Is that right, Steve?
Yeah, that's cool. Yeah, or they can email them in or call in on the phone after the meeting as well. So the chat's one format, or people can email any questions in. But absolutely right. Once we get further details, we can do a Q&A out to people.
Great.
Thanks, Alan. Can I just ask a question? I can because I'm the chair, so I can ask a question. In terms of workplaces, what we're talking about, would that still apply to sort of charities and voluntary groups if they employ people in
anywhere where people are employed, whether that's on a paid or unpaid basis, is a workplace? Yeah.
Okay, great.
Yeah.
Thank you very much.
Thank you.
Thank you for that, and quite concise. And to me, if I summarise it with my simple way of phrasing things, it seems that we've had legislation in place that helped guide us through this Now there's going to be a lot more social and personal responsibility with this, but the public health messages have not changed. The need to do what we need to do has not changed. The emphasis on why we're doing it, perhaps to some people, has changed, and that might cause some issues come Monday. We said we've sort of guided folk to put questions in the chat, but I don't know if anybody has a burning question at the moment. But the caveat is we might not have the answers at all. We've got one popped in there from Lynn. If a charity is asking visitors to wear a mask and refuse, could you ask them to leave?
I'll take
My
that.
view, go on, sorry, Alan, go on.
Yeah, I mean, these things, this is down to the basic common law. It's always been the case that there doesn't need to be a statutory restriction in place. If you decide that you want people to wear masks in your premises, then that's your right as an operator of premises. The public have no right of access into a charity shop or a charity organisation. So each individual organisation is free to set its own rules and enforce them accordingly. Obviously, which is a kind of change, a big change in onus, a big flip from what we've got now, where is a legal requirement to wear a mask, but many businesses have failed to kind of challenge that. We've had this situation for a long time where employees, sometimes, sort of on low wages, are not confident or unwilling to challenge people that are not wearing masks, because there has been a kind of big change in culture recently with mask wearing. Participation has been falling, but people that didn't want to wear masks, when challenged, and the experience that we had in the COVID Marshal Service was that they were could be kind of aggressive with it, as well as not wanting to wear the mask. They were kind of a bit grumpy about it, and if you challenged them, they would, could become abusive or shout at people. And I think that has always been the problem with it. And that coupled with the fact that the police were the enforcing authority and not the local authority, and the police, with the best will in the world, just never had the resources to actually properly enforce that, because they were dealing with other crimes and other matters. There's another question about enforcement powers.
Yeah, there is, from Charlene, but I was just going to come in as well, because I'm aware that, well, according to the media, the metro system is going to require people to wear masks. But I think, coming back to the enforcement point, I might be wrong, it seems to me that the enforcement, in inverted commas, is going to come down to the individual bookshop, metro system, taxi company, business. So in terms of, if dare I say, from the role that you've had previously, or enforcement role, that won't be there in the same sense that it was before. It's going to be choice. If you want to go in somewhere and they say you've got to wear a mask and you don't want to, you'll have to go elsewhere, I would suspect. Would that be fair, Alan?
Yeah, I mean, just the masks, I mean, just be clear on mask was, even when we had the full toolkit of powers in force, when we were back in step 1, step 2, masks was always a police enforcement matter. The local authority couldn't enforce it. And even in premises where, the big challenge was, I'll give an example of, but it's not limited to, somewhere like the Bridges, an indoor covered shopping centre. The question was asked on many occasions, can the council serve a notice to require the Bridges to enforce mask wearing? And the answer was that because masks was a specific piece of legislation enforced by another enforcer, we couldn't. So whereas, we had the power to close down a premises, and we did, like an office employer who had too many people in and insufficient ventilation and et cetera, we could close that workplace down and say that's an unsafe workplace. We didn't have the power to require by direction a business to enforce mask wearing, because it was a personal responsibility in those public areas. We could never do it. So going forward, with the best will in the world, I mean, I can see that people like TfL have made announcements about retaining mask wearing and other sort of transport providers. And if Nexus make a similar announcement, then, that's all to the good. But I'm not sure how that's going to be enforced, because literally the sanction is to physically remove someone from the metro system. And I'm not sure that they're going to have the resources to do that, really.
Yeah, and I think that kind of links in a way to a question from Samantha, who's asking, is there a worry that there may be a rise in potentially aggressive challenges to being asked to wear a mask, social distance, etc., by premises or employers wishing to remain safe? I And I think that's partly my concern, that we don't know how the public's going to react with the public, never mind businesses reacting to businesses. It's a tricky one, and it's one of those we haven't got an answer for. It's
It's a political thing as well, because obviously this is a council forum. This is not about, but politically and in the media, this has been billed as Freedom Day. And so there's going to be some people whose attitude to this is, I'm not wearing a mask, I'm not, that's it, and they're going to be very aggressive, very vocal about that. And there's nothing that we as a council can do with that. That is that is just unfortunately a fact of life that we're stuck with, I think.
It is. Liz, you've got your hand up there. Liz Highmore. You're on mute, Liz. You're on mute.
Right. I was volunteering at Terrington Country Park at the weekend, and this person came up to me and said, "Oh, you don't believe in all that COVID stuff, do you? And my GP says there's no such thing as long COVID." So are people still not getting the message? Are GPs not getting the message? Which I find very frightening. And they're going to be really difficult people to avoid.
I think for me, to answer your question, you've answered it yourself in a way. I mean, I can't comment on the GP, but if someone's saying to you it's all nonsense and blah, 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 then I would imagine, yes, there are people who have not got the message, unfortunately, which I think for us strengthens why we need to keep going with the COVID Champion programme, to constantly reinforce those messages, Liz. I can't comment on a GP. That might just be a load of waffle from that individual shouting that to you. But in terms of people not getting it, I think we've always had that through the pandemic, to be honest. But we've done what we can, and we collectively, to do what we can to spread the right messages and behave as we do. And I think we need to continue with that. And picking up on what Alan said, and certainly Kath has said, the public health messages have not changed, and we need to reinforce that. But that won't get away from the things that we've just been identifying, bringing up about the wearing of masks or distancing and things. It's going to be a fragmented day on Monday, I think, in terms of what we experience. But hopefully, I'd like to think that everybody around the virtual table, we're all as one, and we'll continue with the public health messages. Kath, I don't know if there's anything you want to add at all.
Just to come back to kind of Charlene's questions, we do have and did have before COVID and all of the legislation and regulation that went with that, powers under and I'm sure Alan will correct me if I get the title wrong, the Control of Infectious or Communicable Diseases Act 1984. Is that the right one, Alan? But they are much slower, and you often need a magistrate to kind of make the decision for you. So what the COVID legislation did was allow us to be much more decisive and act much more quickly when we were concerned about risks of infection, and go in and potentially close places down. So it's not that we don't have powers, it's just that our ability to use them is significantly slowed, or requires significant other steps to be put in place before you'd get to the point where you'd be able to act on it. So there are still things we can do. It's just that our toolkit, I think, is weaker going forward than it has been in the last 18 months in terms of managing infection risks.
Jackie, and I suppose moving forward as well, if it becomes whereby it's complacent, data shows that there's an increase in it, then those rules will be enforced once again, I would imagine.
I mean, there were statements about, in some circumstances, they might go back and put additional measures in. What we've not seen is what they mean by that at this point. And they were almost at pains to say it was more likely to be guidance than it was to be regulation and legislation. There's only, I think, one or maybe two issues where they've said we may mandate this. So I have seen a statement about the COVID passes, saying if we see rising infection rates and people are choosing to not use that option, they may at some point mandate it, but they've said in high risk settings without saying what they mean by that. So just in those odd circumstances, they've said we might be quite bullish and make something legal again. But I think they don't really want to do that based on what we're being told at the moment. They'd rather go with guidance, but for all of the reasons we've been discussing, that's much trickier in terms of managing the risks and enforcing anything at the end of the day.
Cheers, thank you.
Yeah, just to pick up quickly on a question from Lane about councils in London still having restrictions, and will Sunderland and Alan's responded to that. I think my only bit add to that, I think the London Mayor has particular powers to implement certain restrictions, but I don't know any more than that, and that might be linked to transport and wearing of masks, but I don't know. I know
the Mayor has jurisdiction over transport for London, which is why he can make particular rules for transport for London. The situation up here is different. We don't have the same sort of mechanism as Sadiq Khan has down in London.
Yeah, I had to look into that because I'm travelling down there on Monday. Depending on the route and the transport that I use, depends on whether or not I've got to wear a mask to go down there, or whether or not I just need to pick one up at the other end type of thing and wear it. So the idea is, if you are using transport for London, no matter where you're going, buses are a little bit different apparently, but general transport for London, you have to wear a mask until you get off the bus. And then depends on your place of work as to what their guidelines are, like what Alan mentioned regarding risk assessments around COVID as well.
I know Kath mentioned public health legislation. I am aware in 1876 there was the Public Health Act to deal with cholera. I don't know if we could use that one at the moment, but it might be a bit out of date. I don't know. But
I think, Steve, I think you'll find that was replaced in 1936. So we're on a much more modern piece of legislation now.
Thanks, Alan. I forgot you were there at the time. Yeah.
Yeah, I helped draft it.
Yeah. Right, and obviously we will answer any further questions as and when we can. It will be a Q&A that comes out. There's further updates we are expecting imminently and by Monday. So what we'll do, we've got our network, we've got our ways of communication. Always, please, if you have anything, let us know by email or give us a ring if that's more convenient for yourself. And we will, obviously, I think that Kath alluded to the newsletter coming out on Monday. There'll be updates in that. And it may well be that the newsletter comes out a little bit more frequently as things unfold as we go.
Steve, I know Jackie had asked a particular question by email.
Yes.
About why some people who've been vaccinated still get COVID. Yeah, so I can have a go at answering that for you, because I'm sure it's something, and I'm not clinical and I'm not an expert in viruses, but I'll kind of give it my best shot to give you an answer on why that is. So if people would find that helpful.
Yeah.
And I think that follows on from the last session where Wendy was here talking about the vaccination programme. Yeah. So I was reflecting, we often use the terms vaccination and immunisation interchangeably, like they mean exactly the same thing. But they actually mean very slightly different things, and that helps us to get to the answer to that question. So in terms of vaccination, that's the process of introducing a vaccine into the body. And so when we're thinking about COVID, that process for COVID involves injections. So we inject the vaccine into the body, and to get the best protection, we recommend 2 doses injected 8 weeks apart. So anybody who's had their 2 doses 8 weeks apart would be considered to be fully vaccinated. Immunisation, on the other hand, is the process by which your body responds to the vaccine that's been introduced into it to produce some kind of immune response to it. And as everybody's different, we all get an individual response to the vaccine. And our individual response depends on how effective our own immune system is and how it works. So generally, your immune system would be less effective if you've got a condition that directly affects your immune system, and that can be like an inherited condition that you're born with, or it can be a condition that you develop later on in life. Or you're having some kind of treatment like chemotherapy or radiotherapy, or you take medication. So, for example, long-term high-dose steroids, which will have an impact on your immune system. Or you've had an organ transplant and you take an anti-rejection medication, which intentionally adjusts your immune response to things. Or if you have problems with your spleen, or you've had your spleen removed, because that's a part of your immune system. Or you're very elderly, because just your immunity generally reduces as you get older. Or you're pregnant, and again, part of your body's response to pregnancy is it stops you attacking the baby that you're carrying. Therefore, you have a slightly suppressed immune system at that point. So if you're in any of those groups, it's likely that your immune response is going to be less effective than it is for some other people. For those reasons, every single person's level of protection from the vaccine would be slightly different. So if Jackie and I both go and get our jabs on the same day, we have the same vaccine, our body's responses to them are going to be different, and Jackie's individual level of protection is going to be different from mine, and that's just the way it is. We're all different. And no vaccine gives 100% protection anyway. So that's why we kind of might see that going on. We do need to remember, though, the vaccines are effective and they reduce your chance of, so whatever your normal level of chance would be, the vaccine will reduce your chance of becoming infected, developing symptoms, becoming severely unwell, needing to be admitted to hospital, or of dying if you catch COVID. So the figures that you see kind of reported are different for each vaccine. Technically they're different for each person, but we get like the average figures out in the reports, and they do work pretty well, but we just have to remember they can't completely remove all of the risk. So that's kind of the rationale why, even though somebody may have been fully vaccinated, they may still catch COVID and be poorly with it. Does that make sense? I hope it does.
Jackie, you've got your hand up.
Kath, could you send me that? What have you got it wrote down?
I've got it written down. I'll type it up and send it to you, Jackie.
Just so that I can share it with the targeted projects, because they're trying to encourage people to get their vaccination, but they didn't have an explanation. But now you've explained that to me. Now I understand why my niece has got it, because she's got severe asthma. She's a nurse. She's had her 2 jabs, but her son got it and brought it into the house, even though she's been out in the community working, but she's now got it. But now you've explained that, I can understand why she's got it, because she's quite overweight as well. You know,
and if you think about the level of infection out in our community at the minute, obviously anybody's individual chance of picking it up is increased because there's just more of it out there as well. So,
but her husband hasn't got it and her other children haven't got it, but she got it off her youngest who brought it in the house, you know, and now I understand, because she has got really bad asthma and she is quite overweight, so and that's maybe why it's not touched her husband and the kids. So thanks for that.
Yeah,
thank you. Good question, good answer there, thanks, Kath. But I think that also emphasises that although we've got the vaccines, it's a combo, isn't it? It's the other measures that go along with the vaccines that we shouldn't really
so vaccines definitely are our best defence, but we do also need to carry on with all of those behavioural things that we've all been doing for the last 18 months just to protect ourselves and those that we love.
Could I ask, because there's a couple of queries come up there, could I ask if that same information could be shared with the COVID champions as well, Kath?
Absolutely, yeah, no problem.
I think that would be quite helpful, actually. That's great stuff. Yeah, thank you. I can't see any other hands. If people are, and I hate to use the term okay, because we're going to be facing what's coming on Monday, but for now we're okay. Yeah, well, I'd just like to thank Kath as always, and Alan as always for supporting us today. It's been excellent, and thank you everybody for coming today. And remember to cascade those messages and that information as we do. The recording will be going up onto the website wherever it goes as normal. Keep on putting the questions in the chat. We'll pick those up, but please email any in or through Jackie or anybody else. They'll get to us and we'll forward questions as we go. I just saw something pop in there. My daughter has none of the conditions you mentioned, but she has COVID now. The virus has mutated, so you are obviously
able to get it. Sorry, I didn't have time to write there properly. It's just because you don't necessarily have to have something to lower your immunity. It's just, as you said, how you've reacted to the injections. So anybody can get it, even if you're fit and healthy. You can still get that virus because it's mutated. It's the same as the flu virus. that mutates every single year. And it doesn't mean to say because you've had a vaccination, you're not going to get it, because you could do, because it's changed.
Yeah, yeah.
I think we're lucky at the moment because we've not seen a mutation that is very resistant to the vaccines. So even with the Delta variant, which is the one that's currently sweeping across the community at the moment and transmits very, very readily, we're still getting a good response to the vaccine with that particular mutation. So it's a little bit less effective than we saw with like the Alpha variant's response to the vaccines, but it is still very, very effective if you have both of your doses.
Well, she's had both of her doses and still got it. She's not very well at all. And our boyfriend has the same, and he's got it, and he's had both of his injections too. So it doesn't guarantee your immunity at all. So, and one of our neighbours actually hadn't realised that he can still get it even if he's had his 2 injections. So a lot of people are under the misapprehension that if you've been vaccinated, you won't get it.
No, just hopefully they'll not be as poorly when they have caught it.
Well, goodness only knows what she'd have been like if she hadn't had her injections. Luckily she's had them, but she's really quite poorly.
Well, I think that's a good message to convey to us. Can I ask a question, Kath, if that's all right, before we close?
Of course you can, Steve.
Is it more likely we will get another variant if we have more cases transmitting it through our communities than if it wasn't transmitting as quickly as it is, if that makes sense?
I genuinely don't know. Mutations are kind of a random process, but there are certain circumstances in which the virus has a tendency to mutate more. So often when you put the virus under pressure by reducing its pool of susceptible people, then you'll see mutations arising. But I have seen something in the last couple of days where there was a suggestion that very high levels of infection could also drive further mutations, because obviously there's more virus out there generally. Therefore, by chance, you're probably going to see more mutations. So certainly what you said is very plausible.
Right, okay, thank you. Audrey, I presume that's a heritage hand, as they say.
Yes. Sorry.
And there's a comment in there, I think it's a comment from Sheila. COVID vaccine is similar to flu, doesn't stop you contracting it, but it's less likely to be extremely poor. Yeah, I don't think anything's 100% proof in this world, and the vaccine's no different. But key message is you're less likely, and if you do, you'll suffer less symptoms if you do have the vaccine. I think with God. Right, we're okay. Right, I'll thank you once again, and we'll see you soon, but we'll have to get the meetings put in, but there'll be information coming out. I would think probably by the time we digest what's coming out at the moment, it'll be Monday in the newsletter, but do please get in touch with any queries or questions or concerns that you have, and we'll do our best to answer them. But what we'll probably do, as Alan alluded to, I think, is have a Q&A response with a lot of questions in there. And that's all right for being late, Sheila. I won't hold it against you. Right. Take care, everybody. Stay safe.
Thanks a lot. Bye. Bye-bye.
Bye.